after I delivered my daughter Grace 9 years ago, nearly 9 years ago, I experienced a postpartum hemorrhage. And I had a really perfect pregnancy and a perfect delivery up until the complication happened. And it really surprised me and frightened me. But I was in a birthing center within a hospital in New York City, and the team that was working with me, my midwife, had an obstetrician that was backing her, and he was right outside the door, and the nurses worked really closely together. And as a team, they, got me and my child to a place where we were stable and we were fine. When I went home after delivering my daughter, I started to explore, why me? Why did this happen to me? And there were no real medical answers that I could find up until recently, actually. But in trying to understand what happened to me, I came across this shocking information around global maternal health, and that I learned at that time that more than 500,000 women were dying from pregnancy and childbirth-related causes around the world, and that completely shocked me. I thought that if a woman dies giving life, that it was probably a very, very rare event, and it wasn't as rare as I assumed it was. And I think once I knew the information, I couldn't sort of put it elsewhere. It wasn't enough that I had the care I needed. I wanted to try to help ensure that every woman has that care. So I sort of took a journey in learning more and exploring more, and ended up traveling to Central America and then South America to Peru with CARE. And that's where I kind of got to learn a little bit more about the global statistics and what was happening and what were some of the other causes and what were some of the other solutions. And the more that I learned about the solutions, the more hope that I saw or that I felt. And it made me, I think it inspired me to want to do more and to be able to make a film like this, that I could bring more people into the conversation and into the dialogue, really, that needs to continue in order to address this issue.